Good morning. My name is Ozella Bundy. I am a public affairs specialist with the Social Security Administration, and it is my pleasure to be here this morning. Let me start out by asking you a question. When you usually hear the term Social Security, what comes to mind? What normally comes to mind when you hear that term?
Your old age.
Old, age, retirement. Beg your pardon? They're not going to be there. Okay. So a number of things come to mind. Some things that don't come to mind might be a 17-year-old, 6-year-old. That usually doesn't come to mind when you hear the term Social Security, does it? The thing is, Social Security pays benefits to people of all ages. So what we're going to look at this morning are the various programs that the Social Security Administration administers, and there are several that we administer. We're going to pretty much take a look at the eligibility requirements for each one of those programs, but we're going to place greater emphasis on the retirement program because that is the largest program that Social Security actually administers. And we're going to start out by taking a look at how important this program really is, and we're going to do that by taking a look at how many people receive Social Security benefits. Now, as you can see by the chart, we have over 50 million people receiving Social Security benefits. Over 50 million people. You're going to see various slices to that chart, to that pie. You're going to see slices for retirees and their families. You're going to see slices for disabled beneficiaries and their families. Also survivors, widows, widowers, and children. So again, people of all ages receive Social Security benefits. And let me say that at this point, if you have a question at any point in time, please feel free to interrupt me and ask. When Social Security legislation was first passed, that was back in 1935, we only had one program at that time, and it was retirement. At the time that legislation was passed, Social Security was designed to partially replace earnings that were lost because a person retired. And the Social Security Administration itself was really born out of the Great Depression. But at that time, we had only one program. In 1937, we added our second program, which was survivors benefits. This program was designed to afford some relief to individuals left behind because that main breadwinner died. In 1956, we added the disability program. And in 1965, the Medicare program was added. Now, the Medicare program is the only federal medical program that we have that goes along with the Social Security. And this Medicare program was a program that Social Security handled entirely. We handled everything there was to handle about the Medicare. But in the late 70s, Medicare pulled away from Social Security and formed its own agency. So we no longer administer the Medicare program. Does anyone know who does? Anyone have any idea who does administer that program? Well, it's actually administered by an agency called CMS, the Centers for Medicare and Medicaid Services. They're the ones who administer the Medicare program. The only thing is, when they pulled away from Social Security, they said, we still need you to help us out. Even though that we're going to be handling just about everything pertaining to the Medicare, we still need someone to get people signed up for Medicare. So even though they pulled away from us, we still get people signed up for the Medicare because the people are coming to us anyway to file for retirement benefits. So we get them signed up for Medicare as well. In addition, in a couple of years ago, there was another part that was added to the Medicare that hadn't been there since 1965. And does anybody know what part was added at that time? Part D, payment of prescription drug benefits. So when that part was added, they came to Social Security again, and they said that we still need your help with this part. And when the legislation was passed to add the Part D, the prescription drug part, it was noted by Congress that there were a lot of people already out there struggling, trying to pay their bills and trying to pay the other parts of the Medicare. And if they had to pay all that went along with this Part D, some of them would not be able to participate in this Medicare. So what happened was they came up with a way for people with limited income and limited assets to actually get some financial help to help pay for it. So Medicare came to Social Security and said, we want you to handle that part of the Medicare. So the two basic or main things that Social Security does as far as the Medicare is concerned, we get people signed up for Medicare altogether, and we also help people or help identify people who have limited income and assets so they can get some financial help to pay for the Part D, prescription drug part of Medicare. Now, in 1972, our latest major program was added to Social Security's list of programs that we administer. This was a program that was different from anything else that we have ever administered before because it's a needs-based program. And as a matter of fact, we took this program over from the Department of Social Services back in 1972. Does anyone know what program I'm referring to? Getting close. Anybody else want to try? Anybody ever heard of SSI, or Supplemental Security Income? Ever heard of that? That program used to be administered by the Department of Social Services. But Social Security took that program over back in 1972, so we administer that program entirely. And since that program is different from all of our other programs, we're going to take a look at that one first. Because the eligibility requirements, how benefits are paid, everything's really entirely different with this program. So we'll take a look at that one first, and then we'll go on with our other programs. SSI, or Supplemental Security Income, who can get those benefits? In order for a person to qualify for the SSI, they have to fall under one of three categories. They must either be blind, disabled, or age 65 or older. Blind, disabled, or age 65 and older. Now, in addition, they can only have limited income and limited assets. For an individual, they're only allowed to have up to $2,000 in what we call assets or resources. And for a couple, that figure is $3,000. The most money that we can pay under this program, if an individual has absolutely no other income at all, is $637 a month for an individual, and that figure is $956 a month for a couple. And that is if they have no other income at all. If they do have some additional income, including Social Security, and it's below those figures, then we'll be able to supplement their Social Security and add some money to it. But those are the limits for people who have absolutely no other income at all. Now, this particular program you didn't see listed in the pie chart. And the reason that you didn't see it listed there is because the money that goes to fund this program does not come from Social Security's trust fund, but it comes from the same pot of money that goes to pay for food stamps or TANF payments, which used to be called AFDC payments with Social Services. So the money still comes from that same funding, even though Social Security is the one that administers the program. Okay. Let's talk a little bit about the retirement program, because of all our programs, I'm sure you remember by the pie chart, the retirement program was the largest. And it is the most popular program and the most that we get questions about as far as the Social Security is concerned. In order, first of all, for a person to qualify for retirement benefits, they must have worked long enough to qualify. The law says they must have worked a minimum of 10 years. So you have to have a minimum of 10 years of work in order to qualify for retirement benefits. So how does a person earn those 10 years of work? Is there a certain amount that they have to work and earn? Each year the figure goes up, but the most that you can earn in a single year are 4 credits. So once you've earned a total of 40 credits, which is the equivalent of 10 years of work, you've earned enough to receive a retirement benefit. Now this year, a person earns 1 credit for every $1,050 that they have in earnings. So since 4 is the most that you can have in a single year, once you've earned a total of $4,200 this year, you've already earned your 4 credits for 2008. But it changes every year. But for 2008, it's $4,200. So once you've earned that, you've already earned your 4 credits for the year. And again, you have to have a minimum of 10 years of work in just to receive a check. So who can get a retirement check and how soon? The law says that you can receive your retirement benefits as early as age 62. The first full month that you're 62 years old, if you don't mind a reduction in your benefit amount. Now, some people might decide that they don't want to have their benefits reduced. they want to start out receiving 100% of the amount. So if that's the case, then what they'll need to do is to wait until whatever their full retirement age is before they start receiving benefits. Now, I believe you have a couple of pamphlets there. One is titled Retirement, and the other is titled Understanding the Benefits. Now, the one that says Understanding the Benefits, there's a chart, I believe, on pages 9 and 10. And on the retirement one, there is a chart, I believe, on page 6. Oh. Y'all have it yet?
Yeah, sorry, I thought it was on the same one.
Which one do you have?
I have retirement.
Okay, so it should be on page 6, right?
Yeah.
Page 6.
Here, I'm going to give you the other.
It's in both of them. The retirement one focuses on the retirement program, and the other one is kind of it has all of our programs listed. It summarizes all of them. But in your retirement pamphlet on page 6, there is a chart. And that chart shows, and I'll be showing it up here on the screen in just a moment too, but it shows what the full retirement age is, and it's based on what your year of birth happens to be. So for those people who want no reduction whatsoever, they want to start out receiving 100%, they'll have to wait until whatever their full retirement age is before they first start receiving benefits. If they start receiving benefits early, at age 62 for instance, a lot of people think, well, I know my benefits will start out reduced, but by the time I reach my full retirement age, it'll go up. But that is not the case. If you start receiving benefits early, at 62 or whenever, it's permanently reduced. So it will not increase once you reach your full retirement age. Now, some people elect not to even take their benefits at their full retirement age. They might decide to wait until age 70. And is there any benefit in doing that? If an individual elects to wait until age 70, then between their full retirement age year and age 70, they'll get about 8% per year added on to their full amount. So for some people, that is something, an option that they might consider taking. In some cases, we can pay a spouse of a retired worker. In order for us to do that, that spouse has to be at least 62 years old, or the spouse can be any age. If that spouse happens to be caring for a child of that retired worker, and the child is unmarried under the age of 16 or disabled. Also, in some cases, we can pay a divorced spouse. Does anyone know how long the marriage must have lasted prior to the divorce?
10 years.
10 years. Marriage must have lasted for at least 10 years prior to the divorce in order for us to pay a divorced spouse. In some cases, we can pay a child. And in order for us to do that, that child has to be under the age of 18 or 19 if they still happen to be in high school. We don't pay beyond high school. Or they're disabled with a disability that started before their 22nd birthday. And pretty much all of our programs, as far as children are concerned, it has that same requirement for children to qualify. This is the same chart that you have in your booklets there about the changes in the retirement age. And again, you have to look and see what year of birth you have. And for most of you young people, it's going to be 67. And that doesn't mean that you have to wait until age 67 to start receiving your retirement. You can get the benefits as early as age 62, again, if you don't mind a reduction in your benefit amount. But how much is that reduction? For those whose full retirement age, for instance, is 67, if you start benefits at age 62, there is a 30% reduction that you suffer at age 62. And again, it's a permanent reduction in your benefit. If your full retirement age happens to be 66, where most baby boomers will find that they fit in that category, if you start benefits at age 62, you will suffer a 25% reduction in your benefit amount, and it will not go up once you reach age 66. Let's talk a little bit about how Social Security calculates a person's benefit amount. How many of you have heard that it's based on your 5 highest years? Has anyone heard that? Or 4 highest years, or the last 5 years? You hear a little bit of everything out there, but so what's the truth? Social Security benefits, when we go to calculate it, is based on your 35 highest years of work. Your 35 highest years of work. Now, a lot of times, it does not have to be consecutive. No. 35 highest years. A lot of times when I'm talking with groups, especially maybe like state employees, someone might say, well, I only need 30 years of work in with my employer, and then I can start receiving retirement from where I work. So what if I only have 30 years in? How do you calculate my payment? And the answer to that is, if you only have 30 years in, for instance, since we calculate it based on your 35 highest years, we'll have to factor in 5 0 years to make you have your 35. So those 0 years will tend to do what? It'll pull that benefit amount down. Okay. As a matter of fact, when a person contacts Social Security to file for benefits, we request their earnings record from Baltimore. Baltimore's already calculated their payment, but this is how they've done it. First of all, they'll pull that person's earnings record over their entire working life. And not too long ago, a lady asked me, she said, well, I started when I was 16, but you wouldn't have that, would you? We have all of your earnings, from going back from day one. So we first of all pull that earnings record. We go back and apply today's dollar amounts to what you earned in earlier years. There might have been someone who worked back in the 60s. They might have earned about $6,000 a year. But when we apply today's dollar amounts to it, it might pull it up to $19,000 or $20,000. So we do that first. Once we do that, then we go back and select the 35 highest years of work. And also at that time, we're determining whether or not we have to factor in some 0 years. Once we've selected the 35 highest years of work, we come up with a monthly average over that entire 35-year period. Now, to that monthly average, we have to apply a formula. And the formula says we take 90% of the first $711, 32% of earnings over that figure through $4,288, and 15% of the remainder. What you're looking at is an example of someone whose average earnings over their entire 35-year working life turns out to be $5,200. That's their average monthly earnings over that time period. So when we apply this formula to it, it lets us know that their full benefit amount equals $1,919. That $1,919 figure is the amount that this person could receive if they waited until whatever their full retirement age is before they first start receiving benefits. Let's say that this belongs to a baby boomer whose full retirement age is 66, and let's say that this baby boomer wants to start benefits at age 62. What percentage of this figure would they actually receive? Does anyone remember? They get 75% of that $1,919. So if they start receiving benefits at age 62, what happens when they turn 66? Nothing. The amount is a permanent reduction. Okay.
What do they get? Cost of living?
Yeah, you got the regular cost of living.
So
that's
it does
correct.
go up, but it's certainly
Yeah.
not going to be a big jump.
Absolutely. As a matter of fact, speaking of the cost of living, does anyone know what it is for 2009? 5.8. 5.8 increase for 2009. And that is the largest increase that we've had since 1982. So it's 5.8%. Yes.
The cost of living increased to 5.8. Do you know what the Medicare insurance will be?
Got good news for that too. It is not going up. It's staying the same. Yeah. And for those of you who might not understand her question, a lot of times when there's a cost of living increase in the Social Security benefit, there's also a cost of living increase in Part B of Medicare, and that's the part that people pay for. And a lot of times it just kind of cancels each other out, doesn't it? You really don't see an appreciable difference after that cost of living increase. But for the first time we got this, since 1982, we have a higher increase, 5.8%, and the Part B premium to Medicare is remaining the same as it is for 2008, so it's not going up. So people will be able to see an appreciable difference in their Social Security payment in 2009. Okay, let's talk a little bit about work and how work affects a person's benefit in terms of how much they can receive, because a lot of times people might decide to sign up for Social Security, but they don't want to just retire altogether. They might want to work part-time. And some of you young people, you might have parents that might be working part-time or grandparents that might be working part-time and they're receiving Social Security benefits. But once a person reaches his or her full retirement age, they can make any amount that they choose, and it will not affect their Social Security benefits at all. This is effective with the month that they hit that full retirement age. They could make $1 million if they wanted to, and it will not affect their Social Security benefits. Now, for the months of that year that they reach that full retirement age, for the months leading up to that month, they're allowed to work and earn up to this year $36,120. For instance, if you have somebody whose full retirement age falls in August, then from January to July, they're allowed to work and earn this $36,120. Any amount that they earn over that, they forfeit a third of it, or $1 for every 3. So for instance, if they earn $3,000 over that, then they would forfeit $1,000. And if their checks are $1,000 a month, they just forfeit 1 check. So that's pretty much how it works, and then they can receive benefits for the rest of the year. But everyone else, the ones 62, 63, and 64, they're allowed to work and earn up to $13,560 per year. And any amount that they earn over that, they forfeit half of it, or $1 for every 2. But again, once you reach that full retirement age month, sky is the limit, and you're still entitled to all of your Social Security. Let's talk about another program. This was the second program that Social Security added to our list of programs, and it's called Survivors Benefits. The thing to keep in mind with survivors is that when Congress wrote the rules for survivors, they're a little bit more lenient with survivors than they are with a retirement program. And that's because they recognize the fact that the main breadwinner has died. So for survivors benefits, an individual can get benefits as early as age 60. They don't have to wait until age 62. But they can get benefits as early as age 60 or age 50 if they happen to be totally disabled, or they can receive benefits at any age if they're caring for a child of that deceased worker, and again, that child is unmarried, under the age of 16, or disabled. Now, another thing you're going to see up there are divorced widows or widowers. And so let me ask you a question. What if a person dies, they leave a, and this could go either way, but I'm going to say, what if a man dies and leaves a widow at home who's at least 60 years old, but that man was also married to another lady for at least 10 years prior to their divorce, and she's 60 years old? Which one would actually get benefits from that worker's record? They both would. And whatever one gets would not affect what the other would receive. Not too long ago, someone said, well, what if the person was married 3 times? And the answer is, if they qualify in their own right, those other 2, if he was married to them for at least 10 years prior to the divorce, then it's very possible that all 3 could receive benefits from that worker's record without any one benefit affecting the other. Now, you're going to also see qualifications for a child under survivors. Oh, yes, I'm sorry.
Is it legal for them to write that in the divorce that they will not receive Social Security benefits?
It doesn't matter. They're going to be entitled to it. It doesn't matter what they write in there.
Okay.
That will not override the fact that they're entitled to Social Security. And I think a lot of people might have been intimidated with that, and it might have been written in their divorce decree, but that does not override the Social Security. It doesn't impact it whatsoever. It's just a scare tactic is all it is. Okay. You're going to see qualifications for a child, same as it was for retirement. In order for us to pay a child, unmarried, under the age of 18 or 19, still in high school, or disabled before the age of 22. Now, there are a couple of other categories under survivors that we won't see under the other programs. One are parents' benefits. In some cases, we can pay a parent of a deceased worker. And in order for us to do that, that parent must have been receiving at least 1/2 of his or her support from that worker, from that son or daughter, at the time of that son or daughter's death. And in order for us to actually start making payment to the parent would have to at least be age 62. In addition, we have a lump sum death payment. It's $255, a whopping amount. We only pay that to 2 categories of people. We can only pay that to a surviving spouse who was living with the worker at the time of death or entitled to that worker's record for benefits. And if there's no spouse to pay it to, we can pay it to any children who might be entitled to benefits from that record. And does anyone remember what it takes for a child to qualify? Still in high school. That's right, or disabled before age 22. That's correct.
One question.
Okay.
That amount, 255, was given, I don't know how many years ago.
A lot of years ago.
Why is it that it still remains that amount?
Well, we haven't really seen anything concrete about that, but, and I'm sure they toyed with the idea of just canceling it out entirely, but they probably thought that it would cause a lot of uproar to do that, and they've just left it alone. When legislation was first passed, it was 250, so there was an increase somewhere along the way, but I haven't heard them saying they're going to do anything with it. They just left it as it was, and it just remains the same. At the time, and you're right, at the time the legislation was passed, that 255 went a long way toward paying the funeral expenses, but of course we know it won't go too far. It's just some change in your pocket is pretty much what it is right now. Okay, let's take a look at another program, disability. And this again was the program that was added in 1956, the third major program that Social Security administers, disability. We pay disability benefits to people of all ages. We have people in their 20s who are receiving disability benefits. But the thing that is different with Social Security as far as the definition of disability is that some agencies can pay disability benefits if a person's 20% disabled or 30%. With Social Security, you have to be 100% disabled, but it does not have to be a permanent disability. And the way we determine that, you have to be under a disabling condition, which either has lasted for a year or is expected to last for at least a year, or it's terminal. During that year's time, it's expected to keep you from being able to do any substantial work at all. We look at other things in deciding your disability. We look at your age, we look at your work experience, and we look at your education. So all of that is considered in deciding your disability. Now, as far as qualifying for the disability, if you meet the medical definition, you have to have a certain amount of work in to be eligible as well. For most of us, the law says you have to have at least 5 years of work in out of the last 10, and that's going back from the point that you become disabled. So let's say you become disabled in 2008, then between 1998 and 2008, you have to have at least 5 years of work in during that specific time period. In the case of a very young worker, maybe someone who's in their 20s, they hadn't been out there working long, they can qualify with as little as a year and a half and still meet disability's work definition. Again, you're going to see that in some cases we can pay a spouse under disability. The requirements for a spouse, pretty much the same as it was under retirement. And the qualifications for a child, same as it was under all of the other programs. So identical to that. Let's talk a little bit about the Medicare. The Medicare, again, was a program that was added to Social Security's list of programs in 1965. But the Medicare program has grown so much over the years that they did pull away from us in the late 70s. The Medicare program is divided up into 3 major parts. And we'll be looking at that in just a minute, but it's Part A, which is the hospital part, Part B, which helps with doctor bills, and the Part D, the prescription drug part. But in order for a person to qualify for Medicare, a lot of people think, well, it's just for those 65 and older. And again, that's our largest group of people who qualify for Medicare. And let me say that it doesn't matter what your full retirement age is, whether it's 66 or 67, Medicare is still effective at age 65. So they didn't change that as far as the Medicare is concerned. But a person can qualify for Medicare at 65 or older, or if we have somebody who's been receiving disability benefits for 2 years, they automatically go on Medicare. And that's how you might find somebody in their 20s who's been on disability benefits for 2 years and they go on Medicare after that. Now, for those people who have been diagnosed with Lou Gehrig's disease or ALS, that 2-year waiting period has actually been waived for them, so they get Medicare a lot sooner. Also, people who suffer with permanent kidney failure, and I've seen babies qualify under this category. They have to qualify on the record of somebody who has worked, so they can qualify on mom or dad's record if they're suffering with permanent kidney failure. They can also be eligible for Medicare. Now again, the Medicare comes in 3 main parts. Part A is the hospital part. that helps with hospital bills. And if you have at least your 10 years of work in with Social Security, you're drawing a check from Social Security, you don't have to pay a monthly premium for Part A. Part B is the part that helps with doctor bills, and with Part B, there is a monthly premium for that. It's $96.40 in 2008 and also in 2009, because even though the cost of living increase went up, this is remaining the same. Part D, the prescription drug part, it depends on what plan a person chooses as to what the monthly premium is that they pay. And it also depends on whether or not they have limited income or assets as to whether they'll even have to pay a monthly premium. Because if they have a very low income and very low assets, it might be possible that they don't even have to pay a monthly premium for the prescription drug part of Medicare. This year, in 2008, there are 52 Part D plans for a person to choose from. 52 plans to choose from. But there is an organization that can help people with deciding what plan is right for them. Has anyone ever heard of SHIP, Seniors Health Insurance Information Program? They're actually based out of Insurance Commissioner Jim Long's office, and the only reason that they exist is to assist Medicare beneficiaries in the state of North Carolina. They have a toll-free number. Their toll-free number is 800-443-9354. That's 800-443-9354. But they're based out of Insurance Commissioner Jim Long's office. Any question at all that a person might have about Medicare, such as, do I need a supplement to go along with my Medicare, or why didn't Medicare pay this particular bill, they can assist individuals with that. As far as Social Security is concerned, we get people signed up for Medicare, and we also try to help identify people who have limited income and assets so we can get them signed up for the extra financial help to pay for Part D. Yes. Yes.
On that last screen, all those three things are things that automatically are available to a person at 65, and then if they want supplemental insurance to help assist with these charges, then they can get that from like a United Healthcare or whatever.
Right.
Is that what you're saying?
That's what I'm saying, because with Parts A and B, you see there are deductibles that are there, and I do a lot of work with an employee with SHIP, with the Seniors Health Insurance Information Program, and I've heard her tell people that you pretty much need to have a supplement to go along with the Parts A and B to help cover some of those deductibles and copays that people have to pay. Part D is just kind of different because there's so many plans to choose from and so many things that they do cover. If you don't mind paying more for your premiums, you get more coverage. But if you want to be frugal, you pay less for your premiums. And so, but it's kind of different, and they can kind of walk you through the maze. And with 52 plans to choose from, there could definitely be a maze to have to go through.
Well, the 2009 deductible would be the same as 2008 for hospital.
For Part B, the premium. No, it's just a premium that didn't go up.
Hospital, the deductible 1,024, will it remain the same?
Probably not. It's just the Part B premium that. So they're getting you anyway, huh? You have to stay well. Okay. Social Security has a website, which is just simply www.socialsecurity.gov. And the website was recently revamped to make it a little bit more user-friendly for people, because the previous website had so much stuff on it when you got there that you were kind of confused. But the way it's divided up is that it has all of our programs at the top: retirement, the survivors, disability, the SSI, the Medicare. So depending on what program you have a question about, you just simply push one of those bars and it takes you directly to that particular program and everything that goes along with that program. Also, we have questions here. So questions and answers section. We have over 600 questions with the answers that are located there. So pretty much any question you have about the Social Security, we have information about the Medicare, you can find it under this section. There's other information that we have there. It tells what you can do online at Social Security's website. And there are quite a lot of things that you can do online now. For those people who are already receiving Social Security benefits, if your address changes, you can simply go online and change it without having to go through the Social Security office. If a person has a Medicare card and they misplace it for any reason, they can just go to the website and order another Medicare card. So there's a certain number of things that people can take care of at the site. In addition, we have people who can now file their Social Security application online. So they don't even have to go into the Social Security office and wait in line to talk with someone. They can log on to our website and file their application online. And that is what we're encouraging people to do. As a matter of fact, that's kind of the #1 preferred way of dealing with Social Security. So people are going online doing that now. Any questions that you might have, again, about the Social Security, there are forms and publications that you can access online. And the latest thing that we added was a retirement estimator at Social Security's website. Now, for those of you who are very young, once you turn 25, you're out there in the workforce, once you turn 25, Social Security will be sending you a statement every year. It will come about 2 to 3 months before the month of your birthday, so everybody will be getting it at different times. But this statement will have all of your earnings listed. It will give you an estimate, if you continue to work, as to how much your benefit amount will be at 62, at your full retirement age, and at age 70. And it will give you information about how much disability would be in case you become disabled before you reach your full retirement age, or how much survivors could expect to receive in the event of your death, if you should have an untimely death. So all of that information will be sent out to you once you turn 25. It comes out automatically. And it used to be that you had to write off and get that. But Social Security found that the people who did write off and get that in the past were a little bit more knowledgeable about Social Security than others. So we decided to send it out to everybody, at least 25, and once you start receiving benefits, we stop sending it out. But that's to help people become a little bit more aware about Social Security and their programs. So that's something to look forward to at 25. So when you start getting that, don't be surprised. But that is what we normally do. Are there any questions about anything that we've talked about or anything that we haven't covered yet?
What is the name of the website?
www.socialsecurity.gov. Any other questions? Well, thank you very much for coming today.